It's again my sad duty to report that tragically 13 people have lost their lives today as a result of COVID. And once again, can I express my condolences to the family members of people who have lost loved ones. It's absolutely tragic, and I feel this, everyone feels this. It's awful to have to report these deaths each day, and I know that the Chief Health Officer and the Health Minister feel it as well. The Chief Health Officer will talk about the numbers in ICU and the numbers in hospital. 37,121 tests in the last 24 hours. 91.76% of Queenslanders have had at least one dose of the vaccine, which is fantastic. And in great news, we're at 89%, and of course double dose, which of course means that tomorrow the restrictions on vaccinated people coming into Queensland is lifted. So once again, that's good news for families wanting to be reunited without having to do quarantine. Now the next thing is about our boosters. So we've had 1,093,000, so 62% of the eligible people have received their booster shot. We know that those boosters are an added layer of protection. So from Monday, we are cutting that eligibility to 3 months, down from 4 months. So our pharmacists will be prepared, our GPs will be prepared, our health centres will be prepared. So that brings us in line with what other jurisdictions are doing as well. The Chief Health Officer advised me this morning that it is safe to do that. So can I say to Queenslanders, if you are due to have your booster, please come and get your booster. It is that added layer of protection. Now, of course, we have 2 weeks until school starts, except for our Year 11s and 12s will begin that remote learning 1 week earlier. But can I please say to parents, you now have that 2 weeks to get your children vaccinated. Very, very important. Please don't delay. And we already have 20% of our children between that 5 to 11-year-old bracket that have had their vaccine. We've got 2 weeks to really increase those numbers, and it's great to see that children are coming out and getting their vaccine. And look, they are very well aware of this pandemic. I know my nieces and my nephew talked to me about this. They were very keen to know when they were getting their vaccine because their parents had had their vaccine. So please think about the next 2 weeks booking your children in for a vaccine. Okay, I just want to talk briefly about RATs, the rapid antigen tests. So, of course, today we were out at one of our distribution centres where 1.5 million additional rapid antigen tests have come in, which is great news. We've got 2 million that will be coming in over the next couple of weeks, and these are going out, of course, to our health services and our health testing centres for the public and for our staff. So we've also got a new distribution centre at Richlands, which is under construction. And of course, the Deputy Premier talked yesterday about a couple of companies that we hope to get approvals soon so we can do local manufacturing right here in Queensland. And National Cabinet yesterday, I raised this issue. And can I thank the Prime Minister? He said that the TGA will work closely with the state government to iron out any issues that those companies may have to facilitate their accreditation as quickly as possible. They have to go through the normal processes, but if there are any issues that either party needs, we will fast track those issues and work with the federal government to really accelerate the approvals of those companies, and I thank them for that. So I want to thank Queenslanders for everything that they're doing. Also, too, can we give that reminder that, if you have had your booster and you're double vaccinated, please go out and live your life, but make sure you've got your mask as that added protection as well. And once again, can I just reiterate, as we reach the peak over the next 2 weeks, for our elderly and more vulnerable people in our community to think about limiting their movements. We know this is happening in other states. We know that this is happening in Queensland, and I thank people for listening to this health advice. But if you are young and fit, you're double vaxxed and you've had your booster, there is no reason why you should not continue to go about your normal life. I see that there have been some calls today from mayors to drop that check-in app. Can I just say that's not happening? We are going through a wave at the moment. We're going to be peaking in the next 2 weeks. I need people to continue to check in. That is to ensure that vaccinated people are going into certain venues so they can feel safe during this particular period of time. It's an added layer of confidence for individuals and for families. I have conveyed that to the Lord Mayor this morning as well of Brisbane, Adrian Schrinner. Secondly, if there is a big outbreak, we also want to make sure that we can actually let people know from those venues. So that check-in app will be in use for the foreseeable future. So we'll review that, of course, once we get through this wave, but please, I would urge people to still continue to check in. Okay, I'll hand over to Chief Health Officer, then the Health Minister, then we're happy to take